of women who gained access to pay-as-you-go LPG reported taking on another job. And this was women that were the head of household. Those that were in households headed by males or their spouses, it was about 40%. So we see a large difference here. But nonetheless, over half of women reported additional income from just the time saved when switching from their polluting fuel to pay-as-you-go. We also asked women to self-report how the access to pay-as-you-go influenced their diet. And we found that among those that were the household head, approximately 15% reported eating more diverse foods in their diet, and between 10 and 15% reported consuming more carbohydrates and more protein. And this is due to a variety of reasons about having more time to go grocery shopping or being able to cook multiple meals on the double burner stove. And so all these can have positive benefits on nutrition and food security. And I think this is something that increasingly needs to be measured in these intervention studies. So I'll stop there because I know we're short on time, and I'm happy to answer questions during the panel discussion. Thank you.
Thank you so much, Dr. Matthew, really sharing key findings, interesting key findings from your research and showing the complexity of measuring air pollution, household air pollution and the health impacts. I'm sure that we'll have a lot of questions for you when we start the Q&A session, but let me go first to our next panelist, Professor Pellet. Can you please share with us your thoughts on the air pollution and how can adapting clean cooking solutions and interventions can improve the air quality, the household air quality, and the health impacts as well. Professor Pellet, over to you. You're unmuted. Can you please?
Oh, yeah. So thank you, Yasmin. So it's a pleasure to be here to share my thoughts. I don't have a presentation, so I will just pick this one and share my thoughts on this very important subject. I work in the energy sector, primarily in the energy sector, not in the air pollution sector. So I would try to share my thoughts from an energy perspective, why it is important to have cleaner energy sources so as to reduce the air pollution, both ambient and within the house. This one, and I must say that Dr. Wynn made a presentation on the CHEST program of WHO. So while I was in Terry, my team actually did the CHEST study for India. So we had some fascinating findings as part of that study. This one, I'm sure that WHO has taken care of those recommendations that we had made at that point of time. I think it was in 2019 that we had done the study. This one. So, well, having said that, well, in India, we all know use of solid biomass in inefficient cook stoves, resulting in more than 1 million premature deaths every year. So, of course, these numbers are based on some models. This one, so we might debate on whether how realistic or correct are the number, but the broader fact is that a lot of people are dying prematurely, or the morbidity is also high because of the use of solid biomass in inefficient cook stoves, and that's been the case in India for quite a long time. So if you see, if you review the data for electricity or lighting and for cooking, you would see from the census data from 2001, 2011, then 2011, or before that, there has been a decrease in the number of people who were using, who don't have any access to electricity. So there's been a very sharp decrease from 1991 to 2001 to 2011, and then if you do a census now, probably all households, or at least more than 99% of the household will see that have electricity connection. But if we see the same census data for cooking, then we can see that whether it is in 1981 or 91 or 2001 or 2011, the range of people who are using solid biomass is something around 60 to 70%. for at least for those 4 sensors. So while there has been a huge increase in the electrified households over a period of time, despite different government programs, right from 1992 when the government launched the national program on improved cook stoves and national program on biogas development, there has not been a substantial decrease in the number of people who are using inefficient cook stoves. And this is because of various reasons. This one, of course, is a behavioral aspect. People feel that cooking food in using firewood gives a better taste. But there are also other economic reasons, supply chain issues, technical issues, and so on and so forth. This one. So that's an area where I think we have to see how we can make an impact so that people can move very fast towards efficient cook stoves. And I will discuss more about it later. But more importantly, a figure was shown by my previous presenter, this one, that how the ambient air pollution is also contributing to the household air pollution. There is a WHO report which says that, at least in Indian's context, which says that 25% of the, roughly around 25% of the ambient air pollution, especially in North and Central India, can be attributed to the high household air pollution. Now, that's the point I'm trying to make, is that the household air pollution is contributing almost one-fourth of the total ambient air pollution. That again, that air is coming back, the unclean air is coming inside the house, and it's become a cycle. So we have to see that where we can make a more impact. If we can address the problem of household air pollution, probably a large percentage of the ambient air pollution will also get addressed, and the same air will not come back inside the house. So it will become a virtuous cycle instead of a vicious cycle now. So that's an area where I think we have to look at it, how we can address the issue. The third point I would like to highlight is that the toxic fumes from the solid biomass also have a negative effect on the climate. We all know the solid biomass contains black carbon. The soot contains the black carbon, which is the highest radiative forcing after CO2, and is almost 1500 times stronger than CO2 per unit of mass. That means the greenhouse gas impact is 1500 times stronger than CO2. But thankfully, black carbon is short-lived pollutant, so it doesn't remain in the air. And if you can address this one, it remains for a very short period of time, unlike carbon dioxide, which remains for many, many years. This one. So I think these 3 data points clearly shows that why household air pollution is an important issue and why we need to shift towards a cleaner cooking. We can discuss whether the cleaner cooking should be through LPG or through a more efficient biomass stoves or electric cooking or maybe other sources of energy. But the first, nobody can deny that this is an extremely important issue, and across India, it is important that we need to shift towards a cleaner cooking systems. This one. Now, let me now say that means, despite the government of India, now government actually recognized this problem, and government came out with a Prime Minister LPG scheme, Prime Minister Ujjwala scheme, PMUY, basically to provide LPG connection to all the households who don't have LPG connection. This one, and it's a huge program. Almost roughly around 96 million stoves have been distributed already, and another 7 million are planned to be distributed from 2023 to 2026. So roughly around 100 million households in India would have LPG stoves. This one, but the challenge is that despite such a large number of households having LPG stoves, and the connection has been provided to more than 98% of the households in India. The question is, do all households use LPG for their cooking? So I think the National Family Health Survey of 2019-21, it shows that only 59% of the household in India use clean fuel for cooking. 41% of the households continue to use solid fuel for cooking, especially in the rural areas. 94.8% in urban and rural India, and this is very important, almost equally in urban and rural India. That means in urban area also, in informal setting, the biomass cook stoves are being used in many cases, if not in all cases. And states having more than 40% of the households using solid fuels for cooking are states like Haryana, Himachal, Rajasthan, Uttarakhand, Chhattisgarh, MP, Madhya Pradesh, Uttar Pradesh, Bihar, Jharkhand, Odisha, and West Bengal. So mostly the northern India and the eastern India states. So there is a huge inequality in the use of clean cooking systems also. And a very important figure from a health perspective is that the prevalence of tuberculosis is 179 persons per 100,000 in household using electricity, LPG, PNG, and biogas, that is the modern cooking energy. Whereas the number is about 490 persons per 100,000 in household using biomass. So that clearly shows why why it is very extremely important purely from a health point of view, and of course from air pollution point of view and energy point of view, that is clean energy point of view also, that why we should shift from, or why we should have policy measures and programs to make us shift from the unclean fuel to a cleaner fuel source. As I said, the government did wanted to do that. Whether the government has been successful or not, I think I can discuss this one. I'll stop here and I'll discuss later.
Thank you very much. Thank you so much, Professor Palit. And I'm sure we're going to come back to you with a lot of questions, because I think there is a lot of socio-economic inequalities between urban and rural areas, and we need to ensure equal access to all people, right? So to clean cooking. So now I would like to go back to Dr. Winlo. Yeah, thank you so much for your presentation and sharing with us the WHO work in this area and tools and methods that they have developed and everything. And my question now is, what are the challenges applying these methods at the global level? Can you please share with us how these are being used at the global level, and what are the challenges that the WHO is facing in collecting data, especially in countries where the data is missing?
Yeah, thanks. That's a great question. So I will start with the second part of this question. As you know, WHO is a custodian agency for SDG 7, which is to ensure access to affordable, reliable, and sustainable and modern energy for all. So we're actually responsible for collecting data for SDGs 7 indicator, activity 7 indicator 7.12, I believe. It's the proportion of population really on clean fuel. And so we're collecting data every year, and we release the results in the tracking SDG 7 reports each year. And so this year, the report, the statistic will be released by the end of April, and the full report will be released by the end of June. And so the questions that we use to collect this data is mainly, what is the primary fuel you use at home, right? So this is not really accurate to reflect the personal exposure on house air pollution, because how do you really define a primary? So if you are using two different fuels together, and if you use those one slightly more than the other, and then you'll consider this is a primary fuel. And another thing is, as I mentioned, we only address cooking, and there are other sources like lighting, heating. These are important, but the current survey question are not able to capture that. And the third area we hope to improve is, now we only know the primary fuel, and then what about the second and third, and how's the fuel stacking look like, and how's the fuel transition look like in the household? This part of information is largely missing. So that is a major challenge we're facing for collecting the household fuel data. And another thing I'd like to mention, that because WHO has this global air quality guideline, and so that is serve as the basis for the national government to develop their own national ambient or indoor quality standards. But this part is beyond WHO's work. So WHO can only provide this guideline, but how each national government would do and how they actually bring the standards into their legislation, this part is beyond our scope right now. But we have been requested to help this kind of work a lot. And so this is actually a challenge and something that we would spend some time to work on in the next few years. Thanks.
Thank you so much. Thank you so much, Dr. Minlu. Yeah, of course, I understand that the measuring the impacts of the air pollution is really challenging for countries, especially when you want to collect this data at the local level. It gets more difficult. So my next question to Dr. Matthew, if you can please share with us from your research, and I know that you've done a lot of research in different countries, what was the most reliable and accurate method that can be used to measure the household air pollution and the health impacts?
Thanks for that question, Yasmin. Yeah, so there are a variety of air monitors that we use, and the good thing is they are typically becoming cheaper and easier to operate, which makes collecting this data important. As I mentioned, air pollution levels vary dramatically due to contextual factors. It could be primary fuel, as Wenlu mentioned, secondary fuel, tertiary fuel, ventilation, and other factors, which is why it's important to use these monitors to measure the air quality. We typically use monitors that use these filter-based methods, which are the most accurate. However, I wanted to mention that there are more cost-effective options that are increasingly being used for household air pollution and outdoor air pollution. These are these low-cost sensors. And so there's a lot of thinking in the community about how we can strategically deploy these sensors to get more measurements and calibrate them to more accurate filter-based methods. And so a lot of that work on exposure assessment, including monitoring in kitchens, monitoring outside the home and ambient air pollution, having participants wear the monitors to get a better idea of where all their exposures are. So not everyone is entirely indoors the entire time. They also go outside their home. And I think it's also important to link that with the amount of time they're cooking. So if we can try to understand their exposures during cooking and when they're not cooking, to kind of understand the overall contribution of household air pollution to their overall exposure.
Yeah, thank you very much for clarifying this. And my next question will be for Professor Pellit, please. So Professor Pellit, from the discussion today, we know the WHO standards and guidelines for household air pollution and the opportunity for the adoption of clean cooking solutions and interventions. So I want to understand more about the government in India, about their initiatives to ensure equal access between the rural and urban settlements, because I know that it's a large a large percentage of slums and informal settlements in India. How does the government ensure that these guidelines are implemented in these areas and integrated into the planning process and strategies?
Okay, Yasmin. So as I mentioned in my previous just now, that the government has this big program called this LPG program, or Pradhan Mantri Prime Minister Ujjwala Yojana, Ujjwala scheme, so PMUY. So this scheme has been instrumental in providing access to LPG connection, I would say, to almost like 96 million households as on 31st March 2023, and this has increased now from 2023 onwards. Another 7.5 million households are being provided connection. These connections are being provided free of cost. So till 2016, till the launch of this particular program, we had maybe around 40% LPG connection rate in India. Now this has increased to almost more than 99%, and this one. Now that's the first step on the stage that the government has done, that is providing connection to all. There are challenges whether the adoption rate is high or not. I will come to that. The problem the government also realized, and because many researchers represented to the government that talked about the informal settlements. So if I take a connection, say in a rural area in one state, if somebody says from Bihar and taking a connection in his village or in her village. This one, no. And the government program says that you cannot take 2 connections, and the government data will then always show that he or she already has a connection. Then what do you do? And the person is in Delhi, say, doing migrant labor. This one. So the government, under this new, this one 7.5 million new connections that will be provided, a person, if he is staying, maybe his house has a connection, and if he is temporarily staying in an urban slum or an urban area, this one doing his job, then he can take another connection. This one. So that is also allowed. You can actually transfer your connections from one place to another. So that is also allowed. So more flexibility is being provided in getting the connection. What the government also done is that now, earlier we used to have 14.2 kg refills. Now there are smaller refills, and those refills you can easily get from a fuel station on this one at a market price. Of course, this is if you want to pay the market price, you can easily get them and use them. So the informal settlements can easily get those. If you don't want to take a permanent connection, then also you can use LPG by taking those type of this one smaller refills from the LPG from the fuel stations. This one. So more flexibilities have been introduced into the program, so that more and more people who have been maybe because of not their fault, they were not getting the connection, so they can also be covered. In addition to the LPG, we have been telling the government that the government program should be technology neutral. This one. So the government has also launched a program called Go Electric, primarily to introduce electric stoves, which incidentally are much more cleaner than the LPG stoves because it doesn't emit any carbon also. LPG stoves, maybe it is not emitting particulate, but it is emitting carbon. This one. So electric stoves directly, at least, are not doing that. And if it is connected with solar or other renewable energy, it is you can say it's the most cleanest of all. So the government also has launched this this electric program, and the government had decided that one of the government agencies has very recently released a that means a program providing electric stoves in rural areas. This one, it's about 1 million stoves or something like that. This one of the government committees, which has been steered by the Petroleum and Natural, the Ministry of Petroleum and Natural Gas, they say that by 2030, 25% of our population should have electric stoves, and the government is working towards that. The Niti Aayog, which is the government planning body, very clearly mentioned in its planning report a few years back that electrifying rural energy demand would be the key program. This one also has to shift towards more use of electricity in the rural areas, including electric stoves. In addition to that, biogas is getting a lot of new promotion. Compressed biogas and mixing compressed biogas with the piped natural gas is another program that the government has launched. This one. Also, hydrogen is being mixed with piped natural gas and is being experimented in some states to see that we have a more cleaner option from a carbon point of view. This one. So these are the various programs that the government has launched and trying out different models without being focused on one particular technology, and trying to see that how we can move from an unclean source to a more cleaner source and reduce the both household air pollution and ambient pollution.
Yeah, thank you so much, Professor Palit, for highlighting all these government's initiatives, the government in India, their initiatives, and I think that the transition to clean cooking will happen, but gradually. It will not happen at once. It will take some time, but at least we are on the right direction to ensure equal access and universal access to maybe by 2050, the net zero, as the WHO highlighted, these are the key milestones, 3 key milestones. The first is access to clean cooking solutions by 2030 and modern energy cooking interventions by 2040 and net zero emission cooking solutions by 2050. And we're happy to see that this is the transition is happening in different countries. And my next question now will be back to Dr. Winlow, please. Yeah, so this will be my last question in the panel discussion, and then we will move on to the Q&A. So you mentioned a lot of the WHO standards and guidelines for the air, household air pollution. And I want to understand from you more about the impact on women and children health. Can you please give us more details on this?
Yeah, sure. So because women and children, they are like stay home longer and they are potentially exposed to more health air pollution than men. And also women and children, they may spend time on cooking or collecting fuels. And then there's like Dr. Schupler mentioned, the time poverty there. And then so that may limit their opportunity to attend education or improve their livelihood and such. And from the health perspective, especially for pregnant women and children, we know that house air pollution has a lot of negative impacts. For example, for like a gestational blood pressure or stillbirths or low birth weight, this kind of outcome has well-established scientific evidence. And like Dr. Schupler mentioned, the HAPPEN trial, which I personally involved in. And so pregnant women and children health is actually the main priority of this this study. And although the intervention didn't show much impact, but actually we are also conducting exposure response. So there's a clear linkages between the exposure to specific pollutants, for example, black carbon with low birth weight, especially in India. That part is quite clear. Yeah.
Okay, thank you so much for highlighting this for us. And now I will move on to the Q&A questions because we have a couple of questions here in the chat. So the first question is for Dr. Winlow. So it's, yeah, they are saying many thanks for the presentation. Could you say something about the nonlinear relationship between indoor air pollution and health effects? For example, that reducing emissions and hence exposure by, say, 80% does not reduce the health impacts to such a great degree. So what does that say about appropriate choices of cooking fuel and about fuel stagging?
Okay, if I understand this correctly, I guess that's asking about emission rate targets that we provided in the guideline. So the logic for that is when you have this cook stove or any cooking technology meeting the emission rate target for PM2.5 and CO, and that is your only sources, ideally, and you will likely to see your exposure levels under the WHO air quality guideline, like interim target 1 for PM2.5 of 35 microgram per cubic meter. But in reality, we know that is unlikely because each household, they have multiple devices. And also you have different sources like garbage burning and smoke coming from your neighbors and like traffic, and also ventilation play a role here as well. And so based on current evidence that or the study I have involved in, you have to really have all your devices at home to meet these standards and limited other sources in order to see actually exposure that low enough to really bring you the health benefits. Yeah.
Thank you. And yeah, so we just want to ensure that the presentations will be shared with all participants after the panel discussion. And our next question is for Dr. Matthew. It's from Professor Matthew Leach. And he's asking for the causes of PM during cooking. What is the role of the cooking process itself? For example, frying as a source of particulates as opposed to fuel combustion. Does this explain how electric cooking can be generating PM in the kitchen? Does this mean more attention should be on changing cooking practices, for example, using lids alongside fuel switches?
Thank you. Yeah, so in the one graph I presented, there were high levels, or not high, but some levels of PM and also black carbon. And that is actually the overall exposure. And so there wasn't actually any emissions generated from electricity. It was likely because most of their electric cooking in that study occurred in China, where there was higher levels of ambient air pollution. So the reason why levels for example, were higher among those using electricity than gas in that particular study, I think was mostly driven by exposure to outdoor air pollution. These were exposures and not kitchen concentrations. So even if you have no emissions when you're using an electric stove, if you travel outside, you're exposed to high emissions from outdoor pollution that's driving up your overall PM 2.5 exposure. So that's why we see higher levels of PM 2.5 and also black carbon or soot when that's not emitted from electric cooking. But I also will say that if you are cooking with gas or a polluting fuel that does emit some PM, that the type of cooking can impact the PM 2.5 levels. So yeah, of course, if you can practice some ventilation techniques, covering using lids or especially ventilation, like fans or opening windows or doors, that'll also be useful. But I think something that needs to be a focus in our community is, if you're increasing your ventilation and increasing opening doors and windows, if the ambient outdoor air pollution is higher than in indoors, that may not actually be helpful in some settings. So, but yes, there are a variety of other factors, as we mentioned, aside from cooking fuel, like ventilation, that can impact your exposure.
Yeah, thank you. Thank you for explaining this, Dr. Matthew. And I think we don't have any more questions in the chat box. Do you have any other thoughts that you would like to share with us today, Professor Khalid?
Yeah, just very quickly, two quick points. This one you mentioned about the importance of the scaling of the cooking, clean cooking, and also this one. So one key differentiator, we have two targets under the SDG 7, clean cooking and clean lighting. And the key differentiator between these two, we see a lot progress happening in terms of clean lighting, but not so much progress in terms of clean cooking, or at least there are some progress, but not as good as the clean lighting. The key differentiator, I think, is the behavioral aspects of clean cooking. That means in lighting, that means you are anyway shifting from an unclean lighting to a more cleaner, bright lighting. So there is no behavioral aspects associated with it. But in case of clean cooking, every day you are interacting with the cook stove. Whoever is cooking food is having a close interaction with the cook stove. So unless the stove design, the stove performance is in line with the requirement of the person who is cooking, the same cook stoves cannot be used for, say, cooking something in India and cooking something in Ethiopia, or cooking something in a different country in, say, Indonesia. So depending on food habits and other things, the stove design also has to be accordingly made out. In case of lighting, the same bulb can be used everywhere. This one, it provides the same light. So that's a very important thing that we sometimes miss out while discussing many of these things. The other thing about that the other two panelists also mentioned is the fuel stacking. So what is important is not whether the household, earlier we used to say that fuel stacking is creating a problem, but now we say that fuel stacking is fine as long as all the fuels are clean. This one, so a house may have 4 different type of stoves, but all the stoves should be clean. So that is the key part. Instead of having only one type of stove, which anyway in urban houses we have 3-4 different type of devices, right? LPG, microwave, electric cooking, many other things on this one. So why not rural households also have different type of devices? Depending on their food requirement, they will use different type if that their affordability or if their income permits to have them. This one, what we should see is that they don't have anything unclean in that stack. As long as it is there, then I think there is no problem.
Yeah, thank you so much for this. I'm interested in the socio-economic inequalities and the differences between different cultures and traditions. All these social aspects and economic aspects should be considered and cultural should be considered in our transition to ensure that we are providing clean cooking solutions that fit with all communities. So thank you so much, Professor Khalid, Dr. Winlow, and Dr. Matthew for your discussion today. And Sheetal, over to you now. Thank you.
Thank you so much, Yasmin, and to all the panelists for today's session. And rightly, like Dr. Palit said, that if you're talking about cooking, I think switch, a word like transition is more better suited than switch like, which is more suitable for lighting. And I think moving towards a cleaner stack for cooking is something that we should aim for. Thank you to all for today's session, and I think we had a lot of inquiries about the slides and information shared in this session. So just want to repeat that the recording would be live in a couple of hours from now. We've already shared the link, and I think that should suffice to all the things. Thank you so much to all of you for joining us today. Thanks.
Thank you. Thank you, Sheetal. Thank you, Yasmin, and all my co-panelists.
Thanks.
Thank you, everyone.
Thank you.
Thanks, everyone.